I welcome all of you to Akpabuyo local government on this August occasion in November. I want to thank Her Excellency for choosing Akpabuyo for this kickoff. It is wonderful because our people need to know how the ailment called pneumonia is actually dealing with children. We are grateful.
Actually, Breath of Life blazed the trail by immunizing 1,005 children for the first time in Nigeria. That's the first time that has happened in a large scale that pneumonia vaccine was given. And it has really put Cross River State in the global map for pneumonia fight. And that's why sometimes I doubt Breath of Life as the major crusader in Nigeria against pneumonia, especially childhood pneumonia. Just recently, to 2nd and 3rd of November, we trained community volunteers on prevention, pneumonia prevention and control in the community. That way, what we want to do is to increase that people will go to the communities and touch the people that need help the most. And that's really the heartbeat of His Excellency and even Her Excellency. They want that dividends of democracy, which is especially good health, gets to the people that need it the most at the hinterland.
Thank you very much for welcoming me to Cross River State. The stories are true. This is the cleanest city in Nigeria. IVAC is supporting the International Vaccine Access Center of Johns Hopkins University is supporting 12 organizations around the world with the Small Grants Program for World Pneumonia Day. And Breath of Life Initiative is one of beneficiaries of support. And I'd like to say the organizations that support already have existing programs, and it's because of the great work that is already being done that this organization was selected. And pneumonia is, like has been mentioned, we call it the silent killer. In Nigeria, 17 out of every 100 deaths under 5 years of age are caused by pneumonia. And that's a very worrisome number. So we are calling on more, already the government is already doing things. The vaccines to prevent pneumonia have already been introduced. And we have the pentavalent vaccine that has been introduced. The pneumococcal vaccine that is coming in the first quarter of next year. So efforts are already on ground, but we still need more support. And the easiest way to do this is by prevention, which is why we really appreciate the efforts of the Breath of Life Initiative. And once again, I want to say thank you very much, and I wish a successful World Pneumonia Day celebration for Taraba. Thank you.
Thank you very much, Dr. Shala.
The Breath of Life should not be a pet program. It should rise. It should be sustainable. We need to look at ways of partnering so that this thing can stay, not a one-off affair. And those are the things we need to look at. The last thing I want to say is, thank you very much. WHO, all the other UN agencies are willing and always there to support this kind of program. Thank you very much.
Now, the first preventive measure is to avoid overcrowding and poor ventilation. Overcrowding, I mean, in a room that is 12 by 12, that is 9 ceilings, not greater than 3 persons should sleep in such a room. Number 2, every room must have 2 windows at least, each opposite the other. Now, it's actually wrong for anybody to build a house and there's 1 window or put 2 windows on the same wall. That is going to cause poor ventilation. In the presence of overcrowding and poor ventilation, children will easily get pneumonia. Number 2, if we increase adequate nutrition of our children, they are likely not to have pneumonia. Number 3, if we prevent HIV/AIDS, such children will not have pneumonia. This is the link. When a child that's under 5 has HIV/AIDS, the ability to fight infections will be reduced, and such a child is at risk of developing pneumonia due to tuberculosis and what we call PCP. Thirdly, hand washing. It's been documented that hand washing and hygiene prevents.
You must say no to Ubombo. We don't want it killing our children again. Do you know why this disease is very annoying? This disease, though, it gets prevention, though. This disease, it gets treatment, oh. But now they kill our children past for Nigeria. So we are here to talk about how to prevent Mbombo. We don't want it again, killing our children. It's very simple, oh. Very simple. It is something that you and I can do. The one of vaccination, we have begged government. Government help us with vaccination. And government has agreed to put money in the budget for vaccination. I want us to stay Cross River, they go higher, higher. Our governor said has agreed to put money in the budget. Food that is good for your body and good for your child's body. Is there anyone here where we don't fit do? We know fit do am. If we do these things, we can prevent our children from getting what? Pneumonia. That is what I came to do here. Oh. I came to tell you so that when you go back, you will tell others. My sister, that cover where you cover your child, you know good. Anybody that tells you that to cover child like that is good is not telling you the truth. When you cover the child like that, the bacteria will be spreading and the child will easily get pneumonia. If you are HIV positive, your child does not have to be HIV positive. HIV/AIDS no dey kill again, no. Medicine dey for am. Medicine dey wey you go fit take, your pikin no go get am also. If your pikin no drink that medicine, you no go get HIV/AIDS. If you yourself drink that medicine, you no go transfer to your pikin.